everything in your body is connected and linked together, and all the different structures work together. That is certainly true when we're talking about the connection between the diaphragm and the pelvic floor. If you're suffering with pelvic floor dysfunction, including leaking, constipation, or pain with intimacy, you're going to want to watch this video because we're going to discuss why the diaphragm is so critically important to pelvic floor health. I'm Dr. Amy, PhD trained orthopedic manual physical therapist, and I am empowering women with changing bodies to move pain-free. Many people are not aware that there is a link between their pelvic floor and their diaphragm. And a lot of women who come into my clinic are suffering with a pelvic floor dysfunction. They may be peeing when they laugh, cough, or sneeze. They may actually have pain in the pelvic floor. They may have pain with intimacy. They may be having prolapses, all different issues. And one of the common denominators is not only that they have pelvic floor tension, but also that they are not breathing correctly and not activating their diaphragm. You see, the diaphragm sits at the top at the abdominal cavity. The pelvic floor sits at the bottom of the abdominal cavity. These muscles are supposed to work in opposition. So if you think about it, when you're pooping, you kind of have to bear down, so the diaphragm has to contract. Well, the pelvic floor has to relax in order to let everything pass through in an ideal world. However, if the diaphragm becomes tight and it puts a lot of pressure on that abdominal cavity, well, the pelvic floor can't just relax. It knows that it has to tighten up to hold everything in. This can increase the pressure in the abdominal cavity, which can affect how all the organs are functioning, but it can also lead to pelvic floor tension. And so a lot of women are coming in with pelvic floor tension issues, which they don't know are related to other areas in their body. This is where I struggle with being called a pelvic floor physical therapist. I work on way more than the pelvic floor because what I have found in my clinic most commonly when women are suffering with pelvic floor dysfunction, they actually have dysfunction in other areas of the body. And the pelvic floor dysfunction is just a symptom. And that's the one that tends to get their attention because it leads to things like constipation or peeing when you laugh, cough, or sneeze, or prolapses, pain with intimacy, and the progression goes on. So that's the link between the pelvic floor and the diaphragm. Now, it's also important to note that when you are not using your diaphragm to breathe, you're going to use these muscles up here, the accessory muscles of respiration, all the muscles in your neck. So if you find yourself having a lot of neck tension, it may be headaches, it may even lead to migraines that cannot be resolved. It could be also because your diaphragm is not working correctly. So what we do is we tend to do this shallow breathing. I'm exaggerating, but you know what I mean. You know when you're breathing up in here and not using that diaphragm. So if you find yourself with a pelvic floor dysfunction and you also have had a lot of neck tension throughout your life, the culprit could be your diaphragm. Now, here's another thing about activating the diaphragm that is one of my favorite things of all. A lot of people have heard that when you're feeling anxious or stressed or overwhelmed that you should do the deep breathing, which is great. Yes, you definitely should. They don't understand necessarily why. The cool thing is that when you do that deep breathing, you actually massage the vagus nerve. And the vagus nerve is getting a lot of press these days because it is so critically important. The vagus nerve is your chill out nerve, and it tells the rest of your body to calm down. It can actually pull you out of a fight or flight state. So deep breathing not only decreases tension in the neck, decreases tension in the pelvic floor, it activates the vagus nerve. And I hope by now you're just wondering, how do I do this correctly? Well, I'm going to show you in just a minute, but I want to tell you there's more than one way to do deep breathing. I like to do very simple technique because that's what's easy for me. However, I know many people who like to get really into this deep breathing. There's the yoga breathing, then there's the fire breathing. There's all these kind of different breathing techniques. And if that's you and you want to spend some time and energy going down that rabbit hole, it is well worth your time to go down that rabbit hole. However, I'm going to give you a very simple technique that you can implement right now to help improve your breathing. And just so you know, I have a brace on my ankle and I have Band-Aids on my hands because I fell a couple days ago. So if you're wondering what's going on there, I have a sprained ankle and I'm working through some injuries. But don't worry, I can still do my deep breathing. All right, the simplest deep breathing technique that you will probably ever see. First thing, again, I want to note, I do have a sprained ankle, so my toes are up off the ground. No, don't have your toes off the ground. Just rest your foot on the ground. I just can't put it down because it hurts too much. So don't worry about that. Your feet should be flat on the ground. You're going to bend your knees at feet flat on the ground. You're just laying on your back in a comfortable position on a comfortable surface. This should feel good just laying in this position. You're going to breathe in through your nose for a count of 4, making a big belly breath. So you want to see that belly expanding here. Then you're going to breathe out like you're blowing out a birthday candle again for a count of 4. So that's going to look like this. Can you see how my belly is getting really big as I do that? So I'm drawing all of that air past my diaphragm. Now, no, it's not actually going past your diaphragm, but what's happening is your diaphragm is actually pushing out, which is causing your belly to bulge out. Obviously, all the air is going to stay up in here where the lungs are. But it's helpful to think about trying to draw that air all the way down to your belly, because if I think about just trying to get my diaphragm, so my diaphragm's right here, okay, it's underneath the ribs here. If I think about just trying to do that, for me, the visual doesn't work. So it would look like this for me. It's just easier for me if I think about making that big belly breath and getting more of that motion coming through the belly. Okay, there it is, a super simple breathing technique. Now, what I want you to do is practice that every single day, preferably 2 to 3 times per day, and you're going to do 10 to 20 reps. Now, when you do it initially, you may think that that's a very simple exercise and maybe not even worth your time. However, you will probably find that it's actually way more challenging. I actually spend a decent amount of time in the clinic helping people just learn how to breathe properly. So make sure that you get those deep belly breaths. Now, once you train your body in how to do it and you're able to do 10 breaths basically on command, you can lay down, do those 10 deep breaths, and all of them feel good and deep. Then you can start implementing it when you're sitting. The goal really is to be able to do this belly breathing all day long to decrease neck tension and decrease pelvic floor tension and decrease the time you spend in fight or flight. I know it seems simple. I know it seems like it won't work. However, deep breathing regularly throughout the day significantly reduces pressure on the pelvic floor, which can make a huge difference when you're peeing, when you laugh, cough, or sneeze. If you like this video, please give it a thumbs up. Don't forget to hit subscribe down below. And if you're looking for more pelvic floor help, go check out this video over here.